Do you have asthma? Do you think you have asthma? Have you been told you have asthma? We have a respirologist here today to tell us all about asthma. I'm Dr. Paul Zalzal.
I'm Dr. Brad Weening.
I'm Dr. Lawrence Chow, respirologist.
Respirologist is going to discuss asthma. What is asthma?
Asthma is basically inflammation in the airways, which is usually reversible, resulting in symptoms because of the narrowed airways, coughing, shortness of breath, wheezing. Those are typical symptoms of asthma.
Okay, so who gets asthma? Is it something that's because of your parents, or is it because of the way that you're living your life or where you live? Why do people get asthma?
Asthma can be from kids all the way to people in their 70s and 80s. Sometimes it's diagnosed late in life. And there's certainly a family predisposition, so it runs in families, but often it's because of environment. People are breathing in things into their lungs that is irritating to the airways. Common examples are things like dogs and cats at home because they're allergic to the animals. It gets into the airways, it causes them to wheeze and cough. So those are the common situation, but it can be other things like seasonal allergies and other irritants to the airways.
Okay.
So a bit of an immune system wreaking havoc on your airways. So your own immune system is causing some inflammation in your airways, maybe triggered by something that you're allergic to. So I think I have asthma, or I think my child has asthma. And those are the symptoms: shortness of breath, coughing. I'm gonna go to the doctor. What is the doctor gonna look for on physical exam?
Well, usually they would listen to your lungs to see whether there is wheezing. Wheezing is a common sign of asthma, though a lot of wheezing may not be due to asthma. Wheezing can be due to other things, but if you have the right history and you've got the wheezing and other findings that may suggest asthma, then we would do some testing to confirm that.
And that's what I think the average person may not realize. When we listen to someone breathing, you actually don't hear much. You actually don't want to hear a whole bunch of things. But asthma has a very specific sound to it that a trained ear will identify as a tightened airway where it's whistling through that tiny little tube.
Wheezing, as opposed to whining, which I do a lot of.
Okay, so now physical examination, so we're suspicious. Do we typically get a chest x-ray regardless of age or story?
No, we don't usually do a chest x-ray for asthma because chest x-ray is most of the time is normal.
It's gonna be normal.
Often you just don't see anything abnormal on the chest x-ray for asthma.
Right. So we've talked about this in some of our other videos about spirometry. Would we typically do spirometry and take advantage of some of the medications to see if it improves it?
Right. So absolutely. So to diagnose asthma, usually we do the blow test, the spirometry, where you blow really hard to see how quickly you empty out the lungs. And in asthma, to confirm the diagnosis, usually we would give this short-acting medication called Ventolin or salbutamol is used commonly, it's been available for decades, to look for what we call reversibility.
Right.
So we do the baseline testing, blow out as hard as you can, give you the Ventolin, couple of puffs, wait like 5-10 minutes, do it again to see whether there's improvement. If there's significant improvement in these objective measurements, then we can make the diagnosis of asthma.
Okay, so we've got the history, we've got the physical examination, and now some treatments. How do we treat asthma?
So prevention, so try to avoid things that are irritating your airways. So if you have cats and dogs and you've been shown if you're clearly symptomatic when you're near cats and dogs, so if you have skin testing showing you're allergic to cats and dogs, then try to, give your beloved pets to your friends or family if possible. If not, then, there are things that sometimes can be helpful, try to keep the pets outside your bedroom, etc. Smoking is clearly not good for asthma. In fact, it's a double whammy because smoking can make asthma worse and can cause COPD, which is another topic. And then puffers. Puffers are very useful for asthmatics.
All right, so avoid the thing that's triggering your asthma, the dog or the cat. In my household, it'll probably be me moving out and the dog would stay. And 2, the puffers. The puffers are things that you can take that can reverse that squeezing of your airways and open them up so you can breathe better.
Now, with respect to the puffers, so some people think, I'm sure, are wondering, so I have asthma, am I always short of breath or does it fluctuate depending on my exposure? So people talk about asthma attacks. So say if I'm not having an attack, am I still taking a puffer on a daily basis?
No. These days, depending on the severity, most of the time we like to use medications on an as needed basis.
Right.
And there are different medications, but often it's used as needed only. So if you're symptomatic, you're wheezy, you're short of breath, take your puffers that can give you the relief. And if you have exercise-induced asthma, meaning that you only get symptomatic with exercise, when you go to the gym, on the treadmill, on the bike, you start wheezing, then you can use your puffers 5-10 minutes beforehand
Right.
to open up the airways to prevent the airways from clamping down, causing the symptoms. And that's quite effective.
And now, not to be a Debbie Downer, but can you die from asthma? Can you die from an asthma attack?
Yes, you can die from asthma. Not very common, but it's very sad when it happens because it's usually reversible. But sometimes, if your asthma has been poorly controlled for a long time, and then you get exposed to something else that makes it even worse, such as like an infection, then yes, when the airways are so tight, sometimes you cannot breathe, and people do die from asthma. It's very unfortunate.
So that's a take-home message here. Asthma is, it's very, very, very common, and 99% of the time it's very treatable and benign, but it can be fatal. So take it seriously if you have asthma, and always make sure you have your puffers with you or people around you know that you have asthma in case this starts to happen to you.
And obviously, if you are using your puffer and it's not doing what it normally does for you, that's time to call 911 or get to the hospital quickly.
Absolutely, yes. There are good medications out there to treat asthma. And we also know these days that if your asthma is poorly treated over a long period of time, there can be what we call remodeling of the airways. The airways can change and becomes irreversible, so that the puffers don't help as much. And then you can get more serious and long-term symptoms, which is unfortunate, but it can happen. So take it seriously.
Sure, now you know. Now you know all about asthma. If you have this, please leave a comment. Let us know your experience with asthma or if your child has asthma, and follow your doctor's instructions on the medication and the preventative measures to take.
And one more question. If you have asthma as a child, can you grow out of it? Do people actually grow out of it at some point?
Yes, sometimes they can grow out of it, and sometimes they can come back later in life. It can be quite variable, yes.
Okay, kids, there's something to look forward to.
There you go. If you like this video, please like it, subscribe to our channel.
Thank you so much, Dr. Chow, for sharing your wisdom and brilliance with us. And remember, you are in charge of your own health and your own asthma.
We'll see you next time.